Yeah, my hands are sweaty, so. Okay, again, welcome. Welcome to the Center PC, our spring fling. We're doing these demos for you to have a good idea of a little bit about what we do here. These are some services that we offer. So what I've been tasked to do is talk to you a little bit about Botox, without revealing and doing anything bad as far as HIPAA is concerned. I'll ask this question in a very special way. How many people have heard of Botox? Ah, you guys are shy. Okay, I know it's more than that, but that's cool. So, Botox is one of the most misunderstood drugs that we inject. Because what Botox is a neuromodulator. And what that means is, it's a chemical that blocks the nerve transmission to the muscle. So basically, it paralyzes the muscle. It's not a filler. We use it to get rid of lines and wrinkles in your face. There are two types of lines and wrinkles. The first one are called active lines or wrinkles. Those are lines or wrinkles that show up as a result of a muscle pull. And then we have static lines and wrinkles. Those are in your skin, regardless of the muscle pull. They may have been caused by that, but over time they've now become static in the sense that they're not there just when the muscle moves, they're there all the time. Those wrinkles can be helped by Botox, but they're not going to get rid of Botox. I mean, I'm not going to get rid of the wrinkles with Botox. So we have to be careful about what we're treating. Now remember, when we inject Botox, we're paralyzing a muscle. So our model here is Pam, and she indicates that she doesn't like the mad wrinkles, the Levins. We call them a number of different things. So when she squints like that, and we can show, so she doesn't like these lines that go up and down. Now when she relaxes, they go away for the most part. But there's still a little bit of that static wrinkle that's left there. Now, a lot of times when you'll go in, you'll get this standard, I want to get they're going to Botox your forehead and things like that, and that's great. So just because you have wrinkles on your forehead does not mean you need Botox on your forehead. Those wrinkles might be there for a different reason. So if I were to do Pam's forehead at rest, I would come up here and I would numb up or paralyze what's called the frontalis muscle. But if I do that, her brows are going to come down. She's not going to like that look. A lot of times, if you have low brows, you unconsciously elevate your brow to try to get them up off your eyes and off of your eyelids. And it creates these wrinkles. So the first thing you do is you go in and say, I gotta get rid of these wrinkles, and they Botox them, boom, those brows come down. You don't like the look. So you have to be very careful when we inject Botox in terms of what we're actually trying to achieve. So this afternoon, we're going to do a couple areas on her. One of the other common areas around the eye are the crow's feet. She doesn't have bad crow's feet. When she squints, they're not bad. We're not going to inject them today. We could, but we're not going to. So today we're going to concentrate on what I call the T area, the 11s. And the other area that's kind of the same area but a little different is what we call the procerus muscle. It lives right here on her nose. It's kind of the bunny muscle. When you do this with your nose, it makes you crinkle up and makes funny things like that. Okay? So what we're going to do, now she's very needle adverse. Okay? How many people are needle adverse, meaning they hate needles? Okay, about the same number that no Botox. Okay, so put your head back. I want you to rest your head. Okay, so we're going to clean up a little alcohol in the area. Now, one of the side effects of Botox is it can get into areas we don't want it. So we inject this area. What's the area where we don't want it? We don't want it on our eyelid. One of the side effects of Botox is what we call an eye droop. So one of the ways when we do these injections, we try to prevent that. We prevent it by not pushing real hard on the plunger, and we also put our thumb in the way so we don't have that. I like to wait till the alcohol dries because that stings when you put a hole through the alcohol. So what I'm going to do is put my thumb right on the muscle there and hold it. That's going to create a barrier for me so that Botox doesn't get down onto her eyelid. I'm also feeling that muscle. It's called the corrugator muscle. It's one of the only muscles in the face that's innervated from underneath. So when we go to inject, we're going to go right in the head of that. We're going to go down to the bone. She's going to hear it. Then we're going to come up a little bit, and we're going to inject about 5 units of Botox. Now, without removing the needle, I'm going to go above it in the head of the corrugator, and I'm going to put another 5 units in. I'm going to hold that for a moment. That's what I do. I want to just make sure. Now, the one thing you can't do, obviously, is because we don't want the Botox in places other than where we injected it, we ask that you don't massage your face. You don't go get this massage over here because your face is in that cradle, and it's going to push the Botox everywhere. Turn your head towards me. There we go. So we're going to do the other side. Leaves a little bit of an area of swelling, but not bad. Same thing, I'm going to put my big thumb in front of the camera. All the way down. I'm going to hold it. Botox lasts about 6 months. You're going to start to see it wearing off in about 3 to 4. So we recommend if you're getting an area treated, you get it treated about every 3 to 4 months. There can be some bruising at the injection site. It's not typical, but it can happen. Crinkle your nose for me again. Okay, good. So I'm seeing she had a very active procerus muscle here. Now with this muscle, we don't go so deep. We just go in under the skin, real little pinch. And we do right here, just a little pinch. Now this area, I don't care if it spreads around a little bit. So I'm going to massage a little bit because I'm going to get better coverage with my Botox. It's going to get to more of the muscle than other than where I just injected it. So we're done. Now, you okay? You there? No tearing? You need a little... How was it? She's going to hit me later. So that's it. I mean, that's it. Now, if we were going to do her forehead, we would maybe, on someone like her, if we had wrinkles, we would come up really high up on her forehead so we don't drop those brows. Takes about 3 days to start seeing activity, a full week to get full paralysis of the muscle. Okay. There's other neuromodulators on the market. They have different ideas as to why they're out there. I mean, we use BOTOX Cosmetic. It's reasonable for us. It's consistent. We know how it works, so we use it. And we use a lot of it. It's one of the most commonly injected things that we do in our spa. I think we all should give Pam a round of applause. Okay, you stopped bleeding. Good. Good. Well, thank you. I think our next one is at 4:30. We're going to do another perfect pout, which is kind of cool. If you didn't see the first one. Oh, yeah. We did this on the radio yesterday, but I want to shout out to Dr. Jeffrey Mader, who put in everybody's swag bag tooth whitening treatments, which we are more than thrilled to be partnering with Dr. Mader this year with this, and we owe him a big round of applause, and thank you from the bottom of the center PC's heart, wherever that might be. But thank you again and enjoy.